So we have an Animal Health and Welfare Board, note, for England, not Wales, Scotland or Northern Ireland. The border stops in the north, and Hadrian's Wall offers Dyke, we do not cross. Now this is part of what was called cost and responsibility sharing. And I suppose this is how it evolved and developed. It goes back many, many years, Curry report in 2001. It goes back to the Radcliffe report, which was published a little over 12 months ago. And it goes back to a decision by Hilary Benn to invest time and trouble in developing some sort of animal health and welfare delivery body, agency, he didn't really know. And I sort of got involved in this because of the Fallen Stock Company and because of my experience in doing that. And I sat on a platform with Hilary Benn when he was Secretary of State about two and a half years ago, maybe more. And I actually said then that I felt it was a once-in-a-lifetime opportunity to empower animal keepers and farmers, build trust and forge a working partnership at all levels. And I sort of kept those words because to me, that's what this board is all about. Building trust between animal keepers and government, but forging a working partnership. And I think over the years we evolved and developed the word partnership, and developing and evolving or devolving powers from government to farmers, responsibility shifts will become very important. So its place, its role, well, it's got one heck of a long role. We actually advise ministers and we communicate that advice. I was asked earlier how we were going to set about advising government. And my response was, actually, we are government. We are a part of government. We might well be a board of independent people. We're not civil servants, but we are an integral part of government. The way government works is that civil servants advise ministers by way of briefing notes and policy notes and whatever. And they sit there developing policy, they have their key industry contacts, whatever. But this book, and in the past, they would take that information to the minister. And in 30 minutes, he would absorb the information on his 4 sides of A4 briefing, ask a few pertinent questions, and have to make a decision. Sometimes he'd ask for more information, but often a decision would be made. What this board does is involves itself in that decision-making process. Civil servants can no longer go from directly to the minister for a discussion. They have to go through the board. Their proposition has to be challenged by the board. That challenge is going to be made public. Those decisions that we make and the recommendations we make to ministers will also be made public. And if ministers disagree with that recommendation, that disagreement will also be public. So it's open, it's transparent, it's interesting. Now the meetings of the board itself will remain relatively closed because some of the information we're dealing with is both commercially and other sensitive. But on the whole, what we're going to try and do is to engage with stakeholders, with the public where necessary, and with ministers, and with DEFRA officials. We want to engage with everybody in that decision-making process. It is a fascinating place to be, and it has never been tried before, in this country at least. So we have to set strategic policy and budget priorities. Let's just touch on budget and lay it down for everybody to remember. Public sector spending cuts. All heard about them. They haven't really started yet. They're on the way. Small amounts being shaved off budget. And in the case of DEFRA, 32% of animal health and welfare spend will no longer be available in the year 14-15. That's 1/3. That is one hell of a cut. And you can't do that just by chopping off a few civil servants here and changing a few bits and pieces there. The only way you will achieve meeting your budget will be to look for new ways of working. And I go back to partnership. Developing key policies and funding. Looking for those new policies and how to fund them. Disease risk assessment and management. We have to set surveillance and research priorities. We have to look for implementation and delivery methods. And above all, effectiveness and proportionality of regulation. In other words, we look at the McDonald report that came out last year and work to that. And approval of operational and contingency planning. Virtually anything to do with animal health and welfare in England is our role. And it's a hell of a wide role.